I'm Kelly Mayer, licensed clinical social worker, and today I wanted to answer some questions about how to pay for therapy. So maybe you're curious about starting therapy, but you're concerned, and maybe you've heard that it might be very expensive, and you might not really be sure what all your options are. So the first option for paying for therapy is to use if you have health insurance, you can use your in-network benefits. In-network benefits are when insurance companies contract with different therapists, and there's an agreed upon contracted rate. And so if your therapist is in-network, you can go ahead and you can use those benefits. And depending on your plan, there's going to be a copay. So in my therapy practice, when I get a new client, I reach out and get their insurance card information, and I use that information to verify their benefits. And then I can tell a potential client how much the sessions are going to cost them. So that's very helpful, just because you want to make sure you know how much it is going to cost you so that it's not a huge financial commitment. And with the in-network benefits, if you have a health savings account, an HSA card or a FSA card, you can also use that money to go ahead and pay your copay with it. So that's probably the least expensive option for therapy. If you happen to have good health insurance, go ahead, find somebody who's in-network with your health plan. If you don't have insurance, or if you have maybe not very good insurance, or you have a company that it's difficult to find therapists for, you can go ahead and you can check on your out-of-network benefits. So out-of-network is when you can use your benefits to go to any therapist, or also if you have no insurance, you can go to any therapist. So therapists will often do a self-pay discount, or maybe called like a cash pay discount. So in my practice, I have a self-pay discounted rate of $70 per session, and that's for a 45-minute session. So if you want to use out-of-network benefits, or if you have no insurance, it's just a flat $70, and you can go ahead and just pay that with a credit card, debit card, or if you happen to have a health savings account or HSA, FSA funds, you can go ahead and use that to pay that self-pay discount. The other thing that a lot of people don't know about is when you do out-of-network, I can go ahead and I can give you what's called a super bill. So a super bill is basically just like a receipt or an invoice, but it has all of the insurance codes on that receipt. And so you can go ahead and take that. It's just a one-page piece of paper. You can go ahead and you can submit that to your insurance company. Even if I happen to be out of network for your plan, you can take that receipt I give you, submit it to them, and worst case scenario, they'll probably put that at least towards your deductible. Best case scenario is whatever your out-of-network benefits are, maybe they'll send you a partial reimbursement. But it's at least worth a shot, because if nothing else, at least it goes towards your deductible. So it's not just, paying for it just out of your pocket with no benefit at all. So those are kind of the two main options: the in-network versus the out-of-network. Another option that can be really helpful is if you work full-time, and you may be able to get what's called an EAP, which is Employee Assistant Plan. So this is a lot of times the Human Resources Department will offer a certain amount of sessions. It might be like 4 sessions, 6 sessions, 8 sessions, something like that. But if you reach out to your HR department and ask about if you have any EAP benefits, and how you can go about getting that. So I am in network for some EAP plans, and what's really great about that is you don't have to pay anything at all. So it's only going to be a very limited number of sessions, but it doesn't cost you anything at all. And then it's usually renewed. It might be renewed once a year. So even if you can't afford therapy, maybe you can get 6 free sessions every year. And I mean, that's still a lot better than nothing, because we can still accomplish some things in a short amount of time. So those are basically the kind of options for therapy. So just kind of wanted to go over and kind of explain it, because I know the insurance can be very complicated, but I just encourage, if you're interested in therapy, especially with me, just reach out, and I can go ahead and I can verify your insurance, and I can at least just tell you what your different options are, and what might be the best plan financially for you.